Call to order the July 25th, 2014 Buffalo County Health and Human Services Board meeting. We have a lot of distinguished people here today, and some will be introduced later. I'm just glad to see the sheriff and the police department sitting together. But anyway, that's always good. We as a board recommend and look forward to people who are running for position for the Board of Commissioners or whatever that want to be recognized and be here in order to see the ongoing meeting and how this particular group works. And we're very fortunate today to have Nancy Walden, who is a potential Board of Commissioner. And we appreciate you being here, Nancy. Would you like to say anything?
I'd just like to say thank you. As a former teacher and a guardian ad litem, I know what you do. And as my husband is already serving on the Board of Commissioners, he talks about all of you a lot. And I know you're the unsung heroes behind a very great county. You're what helps make it the place to live that it is, a great place to live. So thank you very much, and thank you for letting me be here.
Thank you, Nancy. We appreciate you taking an interest in a very important part of county government and in this particular board and what it represents. Frank, you have someone you would like to know?
I do. I have a young man with us today. This is Preston Roach. Preston, if you could just stand up so everyone can see you all the way back here. He is the director of the I Have a Dream Foundation. He's just a very young, motivated individual who's very interested in helping this community.
Thank you guys for allowing me to be here. Again, my name is Preston Roach, and I'm the director of the I Have a Dream Foundation. If there's anything I can do to help, I'm here for service. Human services, I'm not really in healthcare, but human services, this is what I do on a day-to-day basis, trying to change the lives of our young people within the county. So again, if there's anything I can do, I'm at your service.
I'm glad to meet you. I'm glad to meet you because I'm always having dreams. And now I know who to call. So thank you for being here today. Also, Ed, you're hopefully in August going to be recommended by the Board of Commissioners to be our dentist representative, and we appreciate you being here today to see what's going on, and so we look forward to hopefully working with you.
Thank you.
We're glad to have you here.
Director of the dental department. He was a very diligent candidate, and he wanted to be educated and learn about what we do, and I appreciate all the due diligence.
Thank you. Thank you very much. Okay, that brings us to our board agenda. Does anybody have any questions or additions or whatnot to the agenda? If not, I'm going to accept it as it is been presented. We need to then look at the board minutes. We've all had a chance to review those minutes. Do you want to have any additions or subtractions to the minutes? If not, do I have a motion that we accept them as presented?
So moved.
So moved. Second?
Second.
Thank you. Second. Any questions? All those in favor say aye.
Aye.
Opposed, same sign. So be it. I'm a little bit concerned about today's agenda because Paul, you came in with your helmet and that sort of scared me. But
I biked over today.
It's nice to know that some people try to keep themselves in check. Thank you.
I did notice there were no bike racks out front, but
very good. Okay, financial situations. We have no reports today on finances, and the reason for that very simply is the fact that we haven't finalized the finances at this point, and we were instructed by Jim the last meeting that would be no reports this particular meeting. We will see it at next month, and we always look forward to this report, but there'll be no financial dividend. Okay, we have a distinguished looking panel here, and so Mandy, if you'll do the job.
I know we've talked in board a couple of times for all citizens with a particular focus on women and children and those who live in domestic violence. Commissioner Jones, as many of you know, works for the YWCA National Organization. As she traveled around the United States, she saw that boys were very engaged in services around domestic violence, and she shared with us some evidence-based programs that she learned about through her work. Dr. Rich Munger and I'm going to introduce Judge Knight, kind of took off and ran with those, and a very dedicated group of community leaders, many of whom you're here from today, have been meeting weekly to work on bringing a comprehensive domestic violence plan to actual implementation in our community. Judge Knight's going to lead us off. I think most of you all know Judge Knight. I always say about Becky, she and I began our careers together. She was a county attorney who did most of the DSS cases at the same time I was a line social worker. I kind of stayed stuck at DSS, and she was broad enough thinking to also do time as assistant district attorney, where she specialized in sex crimes and violence against women, crimes related to violence against women and children. She then went on the bench as a district court judge, led many initiatives specific to innovative programming across the state and within our own judicial district. She retired and has been in consultant work for us, and has been for a couple of years, and she is really driven this project. I can't thank her enough. I'm sure it far exceeds the hours, and her passion for the work is evident in every step along the way, and I think she's going to kick off the panel.
I don't think we need to introduce the sheriff. Sheriff Van Duncan is seated to my left. Tim Splain from the Asheville Police Department. Missy Reed is here from Changing Together. You'll learn more about that as well. Ann Flynn is here from Helpmate. And Katie is here from Health and Human Services, the Program Director. So we're glad you're here. And Krista is going to rescue me every time I mess up on the computer. What we're going to show you is a video. I don't know if you've seen it or not. It's part of the Enough campaign, which is a public awareness campaign around domestic violence that was prepared.
Over the past year, a lot of stakeholders in Buncombe County, to include the Sheriff's Office, Asheville Police Department, the District Attorney's Office, Mission Hospital, Health and Human Services, just a cadre of folks, to include Commissioner Holly Jones, have been working together to try to come up with a better best practice for how we deal with cases of domestic violence. What 2013 really showed us here in Buncombe County was that that problem is increasingly getting worse. In 2013, we had 5 intimate partner domestic violence homicides. So with the conversation that had been going on, which was really highlighted by those tragedies in 2013, a group to include retired Judge Rebecca Knight came together to draw empirical information and really look around the state as well as the country to look at best practice models that were out there in place and working to reduce those intimate partner domestic violence homicides.
The Buncombe County Comprehensive Domestic Violence Plan is not focusing on just any one area. It has 5 areas of approach, 5 prongs. 1 is a high-risk domestic violence team. 2 is the use of an evidence-based lethality assessment so we can identify victims who are in the most danger. 3 is a focused deterrence program where we can get offenders, get their attention, and let them know that our community doesn't tolerate domestic violence. 4 is an electronic monitoring program to alert victims and law enforcement when an offender has violated the conditions of his inclusion or exclusion zones. The 5th prong is a cross-system dialogue to make sure that we're communicating as a community and as professionals to expedite conveying information where it needs to go as soon as possible.
Public safety has to be our #1 priority. As I've looked and learned more and more about the epidemic of domestic violence and working with the YWCA USA, who has services across the country providing shelter and references for women fleeing domestic violence, I started looking for the best practices in other communities. And I came across a model that had some powerful impacts in Massachusetts. And so very quickly, I passed along this research and this model to staff at Buncombe County, and no surprise to me, but Mandy Stone and Rich Munger jumped on it immediately. They saw the possibility for returning those powerful results that had happened in other communities to our community, and as they say, then things really got rolling.
What I'm excited about in this initiative is the dual focus. There are components of it that are about the containment of the offender, ensuring that the victim's safe, ensuring that the community's safe from that individual, and then there are also components of it that focus on the victim's safety and how we provide the resources to support that victim in moving to a safe and sustainable independent living arrangement for themselves and often their children.
We're incredibly excited that the new domestic violence initiative is taking place. It represents an interweaving of nonprofit and government systems to a degree that hasn't happened before here in Buncombe County. Helpmate will be one of the agencies that does lethality assessments with victims to try to determine what their risk is of murder or attempted murder from their partner. We'll also participate in the cross-system dialogues to try to make sure that we as a system are working as effectively as possible so that no matter where that victim first encounters the helping system, they get the same high-quality level of response anywhere that they may enter.
A lot of times in domestic violence, different agencies have different information, and it's not always been shared in the past because of issues of confidentiality, because of issues of certain agencies are not located in and around the court system, so we don't always see each other. But now with this new collaboration, what we're going to do is make sure that we share information, that we meet on a regular basis to talk about these cases that have been identified as special cases that need the extra attention, and I believe that will allow us to better serve the victims in these cases, better serve the community by making it a safer community, and better able to tailor the punishment so that it will fit exactly the needs of each criminal defendant.
Ultimately, the goal for this program is for women to feel safe in their communities and have peace of mind. In the long run, we also hope to look at preventing violence from the very beginning, and this will start with our children. But I'm very excited about the start that we have and that we're about to embark on.
We had some really good models who posed for us and made some amazing posters that we're going to show you that are being shared around the community. And one of the places, the hallway going to the domestic violence courtroom over at the courthouse, is going to have a series of these posters that have all of our chiefs of police and our sheriff. And they're very effective. And we wanted to share them with you. That's a pretty tough looking guy.
I don't want him coming to my house. Sheriff, you can come to my house at any time.
Thank you.
Thank
This is Chief Boyce of the UNCA Police Department.
Just better get that clear. Yeah.
Pageant for Black Men.
Yeah, serious.
So you can see how collaborative this has been when we've had all of our law enforcement agencies working together on this program. One of the issues is they don't all share the same communication or the data collection, so all their systems don't interface, but as far as their personal commitment, they're on board. Obviously, the credit goes to Holly and to Mandy for their leadership with this program. This is a map of Buncombe County, and it has all of the areas where there were 911 calls received around domestic violence for the fiscal year 2013. There were 7,230 calls in our county alone in 1 year around domestic violence. And then the Child Protective Service reports are in the yellow triangles. I don't know, Katie, if you have any comments you want to make about that part of it, the Child Protective Services piece.
The only thing I would say is that we continue to look to make sure our data is accurate around domestic violence and how we're looking at those pieces to assure that we're hitting all families that actually are involved in any kind of domestic violence.
I don't know if the sheriff or Captain Splain have any comments about their 911 calls.
We just know that certainly we see an increasing volume in 911 calls and emergency response in regard to domestic violence for a lot of different reasons. And our response has had to be refined over time and how we deal with those things. It's not as easy as making a referral on the scene. Many times we're actively involving DSS at that point in time and other social service agencies to try to have a better ending to that situation.
There are probably about 4 or 5 major tools that we'll get out of these 2 comprehensive programs working together that will have huge impact on these type of cases. But one of the things that we found out, and just going from a 911 response perspective, is that how we were tracking domestic violence and how just to make sure that we were getting clean data and calls for service and that kind of thing, because and the judge will get into it shortly about how the state distinguishes domestic violence as opposed to what these programs are designed to impact. And as I said earlier, as the state looks at it, there were 8 domestic violence homicides in Buncombe County last year. But when we look at intimate partner domestic violence homicides, that brought the number to 5. And these programs are really designed for intimate partner domestic violence situations. So we're going to get a lot of refinement of how we do business out of going in and retooling in a lot of ways.
Just reminding the board, you've seen this mapping before, that the shading is percentage below the poverty rate by census tract. The darker color and the higher the rate.
Which is a huge factor of how domestic violence is tied to poverty. It is a definite risk factor, and so anytime we're working together to address poverty, it's going to impact domestic violence.
It may be my eyes, but I can't see the yellow, Katie, on the map. So can you tell me the percentage of Child Protective Services cases that come out of those domestic violence reports?
The last data that I heard was around 55% of our cases involved domestic violence.
Comment on that, Angie?
I would just echo what Katie's saying about we're making sure our data has integrity around that and that we're truly aligning with the same definitions that we're talking about in our community and that we're capturing that. So you may see that increase due to all the conversations we're having.
And a report was issued last week around mass shootings, and Dr. Creighton was at 57% of mass shootings have a domestic violence component in them. So it is certainly a...
Can I say one other thing? I think the reason that it's hard for us to say is that when a report comes in, we screen it for the main reasons that safety is identified. So sometimes domestic violence can be an underlying issue that comes up during the assessment, but we are not aware of that at the screening point. So we're just doing a better job that if at any time we assess that this is an issue, that we are counting that as a case that involves domestic violence. Child Protective Services may not actually have a safety-related issue with it, but it still would be something that we would be looking at the community for services and help around that issue as well.
Ann, you want to add any input from Helpmate's perspective around domestic violence complaints?
We received, and some of these are probably duplicate calls, but we received in that same calendar year, a little over 1,000 calls. So there's probably a lot more calls, a lot more domestic violence out there that's ever really getting reported. And so I suspect that this time next year or in 18 months, we're going to see some pretty amazing numbers of victims that's being helped around domestic violence, intimate partner violence.
When we started this work, there was an existing organization in Buncombe County addressing domestic violence, and it was led by Mission Hospital. It's called the Mission Safety Initiative for Women and Children. It was very broad-based, bringing in a lot of different community representatives. We have worked with them. Our missions are a little different in some parts, but we've worked incredibly well together. And today, Dr. Creighton and I are going over and meet with them and talk about data collection. But their objectives: reduce the violence and the homicides, improve reporting around domestic violence, improve outcomes, of course, for the victims, and to maintain a community plan. And there are several components of our plan where they're volunteering to take leadership to keep that community dialogue going, and we're real pleased to partner with Mission. This is kind of an overview. You saw it in the video of the different programs that we've looked at. When Holly Jones brought this model to us from Massachusetts, that's the only issue we were looking at, but the more we looked into it, we found other programs that addressed gaps, and so we were able to blend them together. The overriding plan that we used was called the Blueprint for Safety, and that's out of Duluth, Minnesota. And it basically was a model for any community that's trying to address domestic violence comprehensively. It gives some guidance on how to do that. And we have followed all of these principles. They include adhering to an interagency approach, building attention to the context and the severity of the abuse in each case instead of just classifying them all as, well, that's domestic violence, to really look at what type of violence and what's going on in that position. Recognizing it's a patterned crime and requires continued engagement with victims and offenders. And I can tell you from the courthouse perspective, there is nothing more frustrating than seeing the same people over and over and over again, sometimes in different partnerships at that time. But that was really important to me to help us understand that this is a pattern crime. We should expect to see the same folks over and over again. Sure and swift consequences for continued abuse. We've certainly built that into this plan. Using the power of the criminal justice system to send messages of help for the victims and accountability for offenders. And then to be very careful about unintended consequences and the disparity of the impact on victims and offenders. I was reading one presentation talking about how the women just seem so hysterical and so crazy, and they don't make good witnesses, and they're not really believable, and so did it really happen? And the offenders are just Joe Cool. Yeah, she gets that way. She'll pack, and it's okay. And what they said was, his behavior does make her crazy, but it doesn't bother him at all. So just understanding that helps us deal with these folks in a better way and not getting swept into how they are appearing to us as being rational. Again, the 6 plans. Now, one of the programs is a cross-system dialogue. This is out of the National Council for Family and Juvenile Court Judges, which is in Reno. They did the same thing. How can communities deal with domestic violence in a more effective way? And one of the gaps they found in this publication they made, which was called the Green Book, was that the community partners did not communicate well. The court system didn't talk to the hospital system, and the hospital system didn't talk to the domestic violence advocates, and so there was just a real disconnect there. And so they created a model for a cross-system dialogue, and I'm really excited to say that our community has bought into this, and this is a pretty vulnerable approach. Basically, we're going to set up protocols for how we talk to each other around domestic violence. It's going to give a forum when things get tough and people are doing the blame game or they're mad, a forum to get that out in the open and solve those problems. And it gives a chance for all these community partners to learn about each other and to understand, like District Attorney Moore was saying, that sometimes we don't share information. Well, there may be privacy laws that prohibit that. And understanding what each organization's privacy laws are going to help us understand why they're not sharing information. Or they call and they don't get their messages returned. And how do we communicate around that? And their policies and their funding. Everyone at this table, except the sheriff and Captain Splain, have different missions. Their objectives, their purposes are different. One issue that talked about a lot in the literature is how a helpmate type organization gets angry with Child Protective Services because they feel like they're re-victimizing the victim when they come in and pick the children up from domestic violence when the victim was trying to get help. And so understanding everybody's roles and obligations is different. The first thing in a cross-system dialogue is every community partner has an internal review in their organization of how they communicate around domestic violence, from the bottom of the organization to the top and the top down. And that organization is looking at where are there gaps, where are we doing a good job, where are we not doing a good job. And a neutral facilitator helps them through that process, and they resolve those issues. Once all the community partners have done that, then key representatives come to a meeting like this and get around the table and start talking about their problems communicating with each other. Again, with a neutral facilitator, and just get it out in the open. What is it that frustrates you when you're trying to call the DA's office? And what is it that frustrates you when you're trying to get hospital records? And why are you upset with Helpmate? And just really get it all on the table and talk about it and solve it. The third step is to develop new protocols based on those two pieces of work to have a new communication plan in our community, and also to make sure that if those key folks who participated are gone, that new folks that come in their place can go to a protocol and say, oh, when I want to communicate with Child Protective Services, this is what I do and how I do it. The why now, why are we including that at this point, is we're undertaking a major change community-wide in how we respond and deal with domestic violence. And so if we're not communicating around that, it's going to kind of implode on itself. So we're making that communication structure so that it can accommodate this massive undertaking. It increases trust. This is what the research shows between the system partners. It increases the confidence within the community. It demonstrates how conflict can be productive, and it leads to positive change. And so that's why we've taken this on. And I don't know if anyone on the panel wants to comment about the cross-system dialogue or their perspectives. Or
I didn't know you just stated that it was Reno that developed some of this cross-system dialogue model. And they are a leader along with Charlotte Mecklenburg in some of the problem-based learning solutions for these multifaceted problems. But what we end up finding out in solving problems in this way, what you really get is a lot of advocacy built between those partners who used to have a little bit of a contentious relationship at times. And what we end up becoming is advocates for one another. Instead of blaming where there's a gap, we kind of do that blameless assessment of where we failed to provide a service or something fell through the cracks, and instead of just putting it off and blaming it, we actually come together and work to shore that up, which I think really helps the victim quite a bit in assessing what's going on, so they don't assume that blame as well.
Thank you. I would just say is just over the time I've been in this type of work, I've been a probation officer. I was a victim advocate for 11 years. I even worked for the public defender's office for a little while. And I have never seen as many people come into the table on this cross-system dialogue ever, talking to each other, talking about what each one of our roles are, and understanding more about where the communication breakdown has been. So I think it's going to be a whole new day with the communication between us as we go into this initiative.
And I'd like to say that in a small way, just by talking about some of the pieces that might be protocols, we've already seen a little bit of the system change. And I have an example from a Child Protective Services situation where there was another call around domestic violence to a home in Woodfin, and Woodfin Police Department responded. And this is a situation that had happened over and over again. And so when the police officer asked the victim if they wanted to go to the magistrates and take out a 50B, which is the domestic violence order, the victim said, no, I'll do that later. And he said, you know what, I'd like you to get in my car and I'll take you over there to the magistrate's office so we can make this happen today. And they made a plan about that. And when they got to the magistrate's office, for whatever reason, there was a discussion about the 50B maybe wasn't the most appropriate. So law enforcement took out charges for communicating threats and assault. And that is something that they had responded before, and that kind of situation had not happened in the past. And so without even having a protocol yet, we are at a place where we're seeing things change differently and in a positive way.
And I think from the health maker perspective, Ann and I were talking about it a little bit earlier, there was a big misconception that they didn't provide services for male victims. And so we've had the chance to be able to have that dialogue in the community, which I think has been helpful. I don't know if they've seen an increase or not yet. But.
We probably have.
The next program is electronic monitoring. It is a program that already exists in Buncombe County. It is run through the pretrial release office. It's used in criminal court cases when a defendant is trying to get out of jail and the judge says, well, I'll let you out, but you've got to be on electronic monitoring. It's used in child support cases where maybe you have a parent who works and makes a whole lot more sense to have them in the community working so they can pay their child support instead of sitting in jail because they haven't paid it in the past. And it's a condition of probation or parole, and that would be from the state level when someone is sentenced and they're being supervised by probation and parole. Electronic monitoring tracks an offender's physical whereabouts at all times. You can monitor their attendance at school or at work. You can enforce curfews if they've got to be home by 8. You know if they are or they aren't. And then you can create inclusion and exclusion zones. The inclusion being where they have to stay. They might be on house arrest. They might have to stay right in their home. Or it could be that they have seclusion zones where they're free to travel, but they can't go to the victim's home. They can't go to the victim's workplace. They can't go to the children's school. They can't go here and there. The technology is amazing. You can pretty much open up the computer and tell them where they are within 4 feet. There is some interesting conversations we've had about the trajectory of the sun and the earth and the rotation, but generally you know where they are within 4 feet. The benefit to law enforcement is if there is a problem and someone's on electronic monitoring, they know exactly where the person is to go be able to intercept them. There is new technology available for victims where they can carry a unit themselves, and so the law enforcement would know where they were, and if there was a domestic violence incident, could literally get between the two. It's a consistent law enforcement message that we're watching you. The Sheriff's Deputy, Jason Ratcliffe, is the one who currently monitors the electronic monitoring through pretrial release, and he has such a great way of communicating that he's watching without being obnoxious. He doesn't say, this is where you were at such and such time. He says, how was lunch at Chili's yesterday? What do you mean? Well, I noticed you were at Chili's yesterday for lunch, and I saw that's where you stopped. Was it good? You know what I really like there is such and such, and makes it into a very friendly, I know exactly where you were at lunch yesterday. Pitt County is who we look at for a lot of our thoughts around domestic violence and use of electronic monitoring. They were getting ready to build this new jail, and I think they decided that electronic monitoring units were cheaper. They have over 100 people on electronic monitoring at any given time. They created a special program around it for domestic violence, and that's continuing to develop. From 2008 to 2011, 58% of the women murdered in Pitt County were killed by an intimate partner. Since they've used this electronic monitoring, only 28% were killed by an intimate partner. So they've had a significant drop. That number statewide is around 22% of women that are murdered in North Carolina are murdered by an intimate partner. Our plan is to have 20 dedicated units for domestic violence. They would be for the really more high lethality, dangerous cases. That the offender gets a base unit and ankle bracelet. The victim, if they wish, and some victims don't because they don't want everybody knowing where they are all the time, they can carry a unit that will alert them if there's a breach. 911 is called if there's a violation, and the Sheriff's Department and law enforcement are immediately notified where the offender is and where the victim is. And that's where their ability to intervene and get between them is immediate. And it would have a zero tolerance policy that any violation other than an equipment malfunction, you go back to jail. Currently, Buncombe County has 8 units that are working, and they're used for a wide variety of cases. So this is adding 20 additional dedicated domestic violence units. I don't know if any of you want to comment or talk about the electronic monitoring.
The only thing I would add to that, a lot of the victims advocates were really excited about this piece because before, all the ownership of modifying behavior had fell on the victim. You know, where you can go, being aware, hardening the household that they live in to make it less available for somebody to have access to them. And now we're actually putting the ownership of the behavior back on the offender. So that was a very positive part of this.
This is my ignorance of electronic monitoring, but what is the supervision end look like? Is it a computer monitoring or is it a person? What is the staffing requirement to participate in that?
The county contracts with a provider. There are providers that do this for a business. And they have, it's kind of like ADT, where they have a main headquarters, and any violation, they get a notice, and they're dealing with it, whether, you know, trying to determine if it's equipment or what it is. There's a notice sent to the Sheriff's Department immediately. And I think one of Mandy's amazingly wonderful suggestions was that should go to 911 simultaneously. So law enforcement is getting a notice that there's a breach, and then they can just open it up and they can see where people are. It's done through Verizon, so there's a couple of places in our county where there's not good service. So that's one criteria. They have to be able to have be in a good zone.
Roughly, what does a unit cost?
It is.
Is it daily, weekly, monthly?
It's a daily fee. The victim's unit is $6.50 per day, and the offender's unit
$650?
No, $6.50 a day. We'd like that by a check. $6.50 a day for the victim's unit, and then $9.50 for the offender, because the offender's got more equipment with his. And so that's the cost. State law prohibits the court from ordering the offender to pay for his share pre-trial, because they're not been found guilty yet. But I did tell some of the judges recently that we might be asking for restitution to the victim, to the county, for the share of the victim's units, if the victims want to carry them.
From thinking about tampering, are you able to, I'm sure you probably are, get metrics on attempts to tamper, attempts to remove,
yes,
attempts to disable?
And they can
that
notify.
sends an alert as well.
Yeah, it's not like cutting off a hospital bracelet. It's a little more
yeah, I mean, I've seen them.
So if they start, a lot of times the notice can get there and the officer can be there before it's completed. They have found that anyone under 20 is a terrible candidate because they cut them and throw them all the time. So that part of that's that judgment, brain development piece. But they're extremely effective. There's also, I don't know if you know about alcohol monitoring units, where if someone's got a bad alcohol problem, they can wear an alcohol bracelet. And so some people may have electronic monitoring so we know where they are, but they also may be wearing an alcohol monitor if they're ordered not to consume alcohol. And a lot of the domestic violence are related to substance abuse. So that's an additional piece. But yeah, technology is really growing fast, and learning how to use it in the criminal justice system is a growing business. Intimate partner domestic violence. Yes, sir.
Is there any push to put the unit on someone regardless, the first time they do something, regardless of whether they're considered to be habitual or whatever? In other words, you indicated that it's put on certain ones. I can foresee where somebody appears to be okay, but would eventually become a problem. Is there a push to eventually put it on everyone that's considered this particular crime?
Based on the numbers we have, I don't think that's a financial option. I think what we are hoping to do, and I'm going to get into lethality in just a minute, is to put it on the people that are the greatest statistical risk of murdering someone.
So we're able to identify those that you're not putting them on, and if they don't become repeaters or something of that nature, then your program is working.
Right.
If they do become repeaters, then they get the...
Hopefully the Department of Corrections takes custody at that point.
Well, I mean, I asked the question because anytime somebody gets this particular identification first, it becomes a big situation to the person who's been the victim. It's nice to know that there's a system that will say very simply is that we'll let you go at this particular time. You run into something else, we're going to put this on you. I'm just concerned about how I would feel if I was a victim and the person would let go.
Right, and the decision as to whether or not someone would get electronic monitoring is made by the judge. We won't make those decisions. We don't have the capacity to make that, but the judge in the courtroom would make that decision. So, and the victim has the right to be heard, and there is a victim advocate who can share the victim's beliefs. The main idea is, if you're the offender, you just got arrested, you may not have a trial for 6 months. So it's how can we let you out of jail so that you can continue to work and do the treatment, do the things you want, but still make sure that you're not chasing that victim around. Yes?
I think I understand where some victims would be concerned about that. We've certainly seen those folks. But I think the lethality assessment will also give us some indication, because every victim is going to get a lethality assessment at various points, and sometimes one, sometimes many. And we'll be able to predict, have a pretty good predictor of that.
I foresee what you're doing and what you're setting up is going to really stop a lot of the repeaters.
So we're hoping.
I mean, that's what your objective is, I'm sure. And that will be a wonderful thing.
And also combined with the focused deterrence aspect of it, which you'll hear about in a few minutes, the constant supervision, the constant reminding of the suspect that everyone is watching them, the whole system is watching them, will probably, if it does the same as it has done in the violent crime aspect, will reduce the likelihood that they'll continue to reoffend and escalate their violence.
Quick question. Did I understand there are 8 units that are operational now? But
right.
What's the timeline for all 20 being operational, did you say?
My understanding is the budget was approved for those 20 units.
I think that the piece we're waiting on, how long we wait, one, we're still working on protocols and other components, and the sheriff should correct me if I say that's wrong, but there is technology that is not, I mean, it's going to be released immediately, but it's not come out that's tied to smartphones. We're trying to make sure we buy the newest technology when we buy it. It's one of those things that's, they keep telling us it's tomorrow, so we keep hoping it's tomorrow.
I think, Mandy, is it the technology piece that allows the victim to where that gives a notification if they get in? The 8 units that we're using are pretrial release units right now. They're not being used particularly for domestic violence folks. The big piece that Judge Knight's going to get to is that lethality assessment. Because we do have a lot of limited resources without the ability to have a very accurate predictor as to where those resources need to go, or the person who is most likely to come back and kill a victim. That's going to be a big piece of this that allows us to put those 20 monitors where they best need to go. And we may have to assess at some point down the time, you know, we may need more than 20. We might not.
We're assuming we'll need more than 20.
Yeah.
The sheriff brought up early in this conversation, general domestic violence versus intimate partner domestic violence. General domestic violence is violence within the family situation. It could be a grandfather and a grandson getting a fight. Siblings, that's all domestic violence, roommates. An intimate partner is that married, separated, divorced, living together, have a child in common, boyfriend, girlfriend, 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 boyfriend, boyfriend, any type of that really personal, intimate relationship. And so the one thing about intimate partner violence is it's a crime where before it happens, you can pretty much identify the perpetrator and the victim. There's no other crime like that. So that makes it extremely different. The red flag around lethality, and that being the risk that someone's going to die, is the increase over time in severity and frequency of the violence. There are known strategies that can disrupt that pattern, and that is what reduces that lethality risk. So the strategies that we're employing are things that we believe are known to stop that pattern of increasing. You will always have that heat of the moment, never been a domestic violence incident where someone gets shot and they're dead, and none of us could have ever predicted it or known it. But most domestic violence intimate partner does have that pattern. It starts off with a shove or an unkind word and ends up with slapping and then strangling and then shooting or some stabbing. IPH means intimate partner homicide. And there's a danger assessment that's been created by Dr. Jacqueline Campbell from Johns Hopkins University. She was trying to get her PhD in nursing. And so she went before the board and they told her what she had to work on her PhD was to do something around predictability of domestic violence. This was 35 years ago. And so she went to the police department, she went to the courthouse, and she went back to the board and she said, I'm sorry, I didn't communicate well. I'm trying to get my PhD in nursing, not criminal justice. And they said, go do it. And it's become her whole career. And she's an international expert. She travels all over the world giving presentations. She's got co-chair of some international organization around domestic violence. An amazing woman. She basically has narrowed it down to there are 19 questions that you can ask that are yes or no. And based upon those answers, you can predict the level of violence and the level of the victim's risk of being murdered. There is a 20th question, which is, have you ever thought about committing suicide, which is added to the survey so that the provider will know to address that with the victim. But it's not a lethality risk if she's threatened to commit suicide. When I'm talking around the lethality assessment, I will say she, and often he is the offender. It's no disrespect intended to anyone. But her research is around female victims of domestic violence. There is no research, and we have looked exhaustively. There is no research or data to give us risk factors for a male-male intimate partner homicide or for a male victim female offender homicide. So guys, there's not enough research out there. I think that work is, if it's not going, it will be going. But that's why when we're talking around lethality, we always talk about the female victim because that's the only evidence-based program there is. What Dr. Campbell found is that 65%, and she's done thousands and thousands of case studies, of murdered or attempted murder victims had either been seen in the medical profession or in the criminal justice system within a year prior to the murder. And more than half of them, 55%, had called the police in the year prior to the murder. Of the offenders, 58% had been arrested in the year before the murder, and 22% had been seen in the mental health or substance abuse system. So her point was, since these folks are coming in front of us, or a good percentage of them are coming in front of us, if we do this lethality assessment, if we can identify they are at high risk, then we can help educate them on how to protect themselves, and the community can respond differently to disrupt that pattern and prevent that murder. We have arranged, and it's just amazing to me, on August the 5th, which is a little less than 2 weeks away, Dr. Campbell is coming to Buncombe County, this international expert. You are all invited. She will be at Mayheck. Buncombe County and Mayheck are co-sponsoring her training. Already, approximately 200 doctors and nurses and social workers and lawyers and judges and law enforcement officers and probation officers, pretrial release officers and teachers have already signed up. There's space for about 50 more people, and that was as of last week. I haven't gotten the current number if we're full or not. There's 2 sessions. They're identical sessions. One is in the morning, one's in the afternoon. And if you want to listen to a presentation via webcam, you can do that in the morning session, which would be a live presentation. There's no cost to do that. If anyone in your organization needs continuing training credits or continuing education, that's available through Mayheck, and you do pay for that fee. What is the benefit to getting all these different professionals in the same room at the same time, listen to the same thing? It's so we can start using the same language. If you go to the hospital, or if you go to the treatment provider, or you go to the courthouse, and you're talking about domestic violence, you're going to hear different words, different terminology, and different contexts. How a victim, and I think Ann brought this up a little bit earlier, how will a victim understand those nuances and those differences? And that those people may be saying the same thing, they're just using completely different words. So getting everybody using the same words, asking the same questions, will help our victims learn through our example that these are the important things. This is what I need to look for. Essentially, it's going to give everyone, whether they're the district attorney in the courtroom, or whether they're the officer responding at the scene, or anyone in the whole continuum of services, to know what those red flags are and how to respond appropriately to that flag. And the third benefit is what I was saying earlier. A lot of offenders come off so jovial because they're not fazed by their behavior. But using this tool means they can't hide behind their charm. They can't hide behind their diversion tactics, which may be anger or remorse or blaming or their job title or their position in the community or their threats or their addiction. Whatever it is, it takes it all off of that to their behavior. And it keeps us focused on their behavior. There is a lethality assessment that's been modified that Dr. Campbell helped do the research on out of Maryland. It's a first responder lethality assessment tool because, as you can imagine, when APD and the Sheriff's Department are going out to a scene, they're not going to sit down and fill out 20 questions. That's not their job to do that. So they created a first responder model that helps them know that it's a high lethality case very, very quickly, and then says, if you find that, this is your protocol. In Buncombe County, our protocol would be you have your phone with you in front of the offender and the victim if they're both there. You, the officer, call helpmate. So I've got somebody here I'd like you to talk to. You know, victim, would you like to take my phone and go over there far away and talk to these folks? They can offer you some information. It makes that first call, which is the hardest call for any victim to make, the first call for help. The officer does it. The offender sees she didn't call. The officer called. So it takes the heat off the victim. It's very effective. What they had found in Maryland, only 4% of their murder victims had accessed domestic violence services. But in 50% of their homicides, law enforcement had been called to the scene before. And their victims who did get help and go into shelter reduced their risk of being murdered by 60%. So it's used by law enforcement, fire, ambulance, CPS workers, emergency room personnel, mobile crisis, anyone who's going into a chaotic situation quickly. It asks standardized questions that are risk questions. Are there guns, threats, increase in severity and frequency, substance abuse? And then it has the protocol that you call for help. In Maryland, from 2006 to 2010, 92% of their law enforcement agencies in the entire state participated in this program. 100% of their domestic violence programs did, which would be our equivalent of helpmate. 100% of their counties did. So that tells you there may have been some law enforcement agencies within a county who opted out. But they ended up serving 81% of their entire population of the state with this Maryland lethality. Over a 4-year period, they increased the number of victims engaging in services. It went from 28 to 56%. They screened almost a little over 22,000 people. But the key thing is the bottom. They had a 41% drop in intimate partner homicides over a 3-year period. 41% drop just from having officers trained to assess it and make a call and engaging that victim in services. Very simple, amazing outcomes. Very hard to get patrol officers who are getting repeated calls to go scene to scene to scene to be able to stop and do conceptually in their minds. I mean, they don't see that as their job, I think. Sheriff, is that a fair statement?
Not as much of a focus as it should be.
Right. So we're asking them to change how they look at domestic violence, and we're asking them to change how they respond to it. And we're convinced that the outcomes are going to make it worthwhile. The Buncombe County plan around that, we've applied for a training and technical assistance grant. If we're accepted, they come to Buncombe County, they train all of our first responders at no cost to us. They provide a year of follow-up. And if we are accepted, which we hope to hear in the next couple of weeks, they could start training as early as September. So those are the two lethality, the Campbell, the 20 questions, and then the long enforcement response. And I don't know if any of you want to comment on that.
I think the numbers are interesting. The 4% of the victims that had called reached out for domestic violence, and then the 58% had reached out to law enforcement. Kind of reflects the amount of calls that law enforcement got in 2013, over 7,000, and the amount that Helpmate got same year, a little over 1,000. So that's just interesting comparison.
I'll just let you know that in Child Protective Services, we will be certifying all of our CPS investigators in using this tool, and a large number of other CPS and foster care workers are attending training as well, and so we will have a big group of people that can respond in any time a case is open with us. So.
We had talked a little earlier about game, and I'm going to refer to it as game changers, how we do business differently, and there's some big ones, and this is one of those big ones. The fact that when the officer responds, there's going to be a call to Helpmate, and that victim is going to get that phone, and that's something that just has never been in place before, and a very underused service. So that will change.
Yeah, and we are beefing up. We know that our crisis calls are going to go up, and we've already seen this fiscal year over last fiscal year 92.5% increase, and we haven't really implemented anything yet. So we're a little in awe, but we're training more and more folks right now. We've got 13 folks in the pipeline that's being trained to take crisis calls. So we have a combination, 24/7 combination of staff and really well-trained volunteers that we put through a very rigorous training. They have to shadow, they have to role play, they really have to know it before we let them take a call. So we're working really hard to be able to respond to those calls.
And if I was sitting in the audience right now, I'd probably be saying, oh my goodness, they're getting ready to generate a huge workload. Well, we are to begin with. But what both these programs show is that the end result is your calls for domestic violence and the severity of the outcomes really start to decrease. So we know that we're going to have an influx of calls, and it's going to be pretty labor intensive to begin with, but the end result is going to be much less of this type of crime.
And that's pretty consistent with any initiative that law enforcement engages in. When we go and we conduct community education, we do enforcement, or whatever our initiative is, generally speaking, we see a spike in our calls for service and increase in activity, and then gradually you see that decrease and it tapers off. I know for the city, I know the county's already done it, but we're going to equip all of our officers with a cell phone so that they can issue that or provide that to the victim and let them make that call and give the phone to the victim to call Helpmate. And then there'll be a training phase for all of us to engage to make sure that all of our officers, when they respond to these scenes, engage in the same protocol, ask the same questions, take the same incident report under the same circumstances, or a field contact report dependent, and then make sure we make the correct referrals and help the victim in the same way. And that's going to be really important for us to do that and train the same way. And I know AB Tech is going to help us with some of that training. And I think in the long run, we're going to see our domestic violence incidents, especially that we experience in the city, is a large part of our job. I just think since it is so large, we just need through all this process to get so much better at it. And I know the sheriff responds to all these incidents. I have too over the years of the intimate partner homicide incidents, and there's nothing worse than what it does to tear up the family, the community, and everyone associated with it, especially when you have as many as we had in 2013. This is very worthwhile.
And Rebecca mentioned that one of the questions, I think the 20th question, have they ever threatened suicide? Well, here in Buncombe County, my memory serves me correctly, of the 5, 2 were murder-suicides. So it is a relevant question. This tool to predict is a very, very time-tested, empirical, dialed-in thing that's going to help us assess which people need to wear these monitors.
Next program that we've implemented, or are in the process of implementing, is an offender-focused deterrence for domestic violence offenders. This is a model developed in High Point, North Carolina. It started with violent offenders and gang members. In High Point, it was so successful that their detectives are sitting around twiddling their thumbs because they're just not having the problems with the violence and the gang members anymore. So they started brainstorming, well, what else could we try this on? And they did, they picked domestic violence. And they've been doing domestic violence since 2009, and they collaborate with UNC Greensboro, who helps them with their research component. It is a successful law enforcement strategy. It's designed for a targeted offender group. It's consistent messaging that the community will no longer tolerate the criminal behavior. It is not victim-driven, it's community-driven. And for the domestic violence piece, it's not just the high lethality cases, which I think addresses part of what you're saying. This is everyone from the first call from law enforcement to the very serious domestic violence offender. They create 4 offender levels. The first one is the first scene. They've never had a history with the person and no arrest is made. The second would be the first arrest. The third level would be the second arrest. And then the highest level, they've either had 3 or more domestic violence arrests, or they're a violent offender with a domestic violence arrest, or they may be an habitual felon or habitual violent misdemeanor offender that also has a domestic violence offense. Or it could be the first time we've ever seen them, but what they did was so horrific and so bad that they jumped to the top of the list. The response from law enforcement depends on what level they're on. It's a much different response for that first time to the scene than it is the most serious person. The responses can include warning letters, they visit them in the jail, they make bond and sentencing recommendations, they make safety checks at the home, the use of electronic monitoring, they have community meetings and call-ins, develop the inclusion and exclusion zones, and priority prosecution from the district attorney's office. But every single contact ends with whatever services you want, we're here to help you. If you need housing assistance or employment assistance. And High Point, from 2004 to 2008, they had 17 domestic violence homicides. From 2009 to 2013, they've had 1. And that was a couple that had moved to High Point from Somalia and had no community contact with anyone. They weren't being served, they were not on anybody's radar, but it was an unfortunate homicide, but it wasn't someone they felt like they had failed. They had 75 fewer arrests in a 6-month period last year as they had in the same 6-month period in 2012. The most amazing piece of their data is a 7.4% recidivism rate. As a repeat offenders, they delivered 940 letters to 940 different people, and only 7% of them reoffended. That is remarkable in the domestic violence field. Their first message, we don't tolerate it in our community. We're watching you. It's not the victim telling you to stop, it's your community telling you to stop, and we've had enough, which ties back into our Enough campaign. The second message is, we care about you. We want you to turn your life around. We want to help you with whatever it is that's your barrier, whether it's education, employment, treatment. You can change if you want, and we'll be there for you, but if you don't change, we're going to be all over you. We're going to ask for the highest bonds, we're going to ask for active prison time and strict conditions. It's, I know we're running short on time, but if anyone quickly wants to comment about the vendor focus program?
I can just real briefly. At least 3 of us here have been students of the High Point model and what came before it for quite a while, and we've been implementing it here in Asheville and Buncombe County. Amazingly, High Point started this over a course of about 16 or 17 years now. With the violent crime aspect of it, they've seen a more than 50% reduction in violent crime consistently over that 15 or 16 years since they implemented this, which means since their city's grown, population has grown, and their violent crime rate is down by more than 50% consistently all that time. That's why, as Judge Knight said, their detectives are sitting around with nothing to do, trying to think of other aspects to attack. We're doing it here with violent criminals. What we foresee with the domestic violence offenders, it's going to be a little bit different. The violent crime folks, they kind of, we call them in and we give them a message that we're watching them, that if they reoffend, we're going to do everything we can to put them in prison, most of the time federal prison. They hear a very harsh message. There's a lot of status for them out in the street that they're so bad that they had to get called in and get this message. Domestic violence offenders want to live in the shadows. They want the power and control over their victim, stay in the shadows, not be seen. This pulls them out. We give them a letter the first time. If they reoffend, we go and see them in jail the second time, give them another letter depending on the severity of the offense. But everybody's talking to them. Pretrial folks are talking to them, probation's talking to them, police department, sheriff's department, child protective services is. Everybody's saying, we know what you're about now, and we bring them out into the light, so it's less likely they're going to continue to offend. And that's where, the worst of the worst will get the electronic monitoring. The rest will be monitored basically through this whole social system of focused deterrence. And it's proven to be very, very effective in how it's been used in High Point especially, who's been kind of the model around the nation.
Can one of you talk a minute about a call-in, like who's there and what that message is like at the actual call-in? Were you going to do that, Miss?
I can do that. At our call-ins, we have basically a 3-prong approach, and that's community, law enforcement, and service providers. So as far as the law enforcement we have there, we have local, obviously the police, sheriff, our local district attorney, and the supervisor for probation. Then we have state agencies such as SBI, FBI, well FBI would be federal, ATF, and then we have the federal prosecutor there from the U.S. Attorney's Office. So all those law enforcement entities' message is the harsh message of, we know who you are, we see what you're doing, and we're not going to tolerate it anymore. And now we're all talking to each other, so if you continue to commit crime, we're going to talk to each other and figure out which one of us can give you the harshest sentence. Then the second component of it is the community component, which we have a couple of key community members that stand up and talk about how the violence in the community has affected them and how they as a community aren't going to stand for it anymore. And we have Walt Robertson, who's retired from APD, does that for us a lot of the times. And then we have a community member, Priscilla Njai, who's been through it personally with her own son and many times knows the young men and women sitting in the seat. So that's pretty effective when she can talk directly to them about their families and that she knows they weren't raised that way. And then there's the service provision component, which is basically all service providers in the community, but more so kind of where the changing together piece comes in, which is what the overreaching message of a colony is supposed to be is, we know what you're doing, but we believe that every life has value, and we believe you have the power to change, and we're here to help you do that if you want to take our services.
But sitting on the board, just sitting here listening to this, I think this is awesome. Because you're not saying, okay, you're a bad person.
Right.
And that's the end of that. You're saying, if we're going to give you an opportunity to change. We're going to help you. But if you're being naughty and you won't, we're going to get you. You know, so you're sort of giving them a choice. And I think this is really good because if you're a victim and you call, I think it's important to know that there's someone there listening to you and believing you. You know, instead of next thing you know, they find you on your doorstep and you're dead. So I'm really impressed just sitting here. I think you're doing an awesome job, and thank you so very, very much.
One thing I have to ask this, I always do. This is a big county, and there are other municipalities. you know you have to start somewhere. Are the other municipalities involved with this, like the phone system and all this type stuff? Because a lot of times we forget about the fact that there are other municipalities, because small as that they are, but they're important people. So everybody's shaking their head, which is glad to see, but
they're all at the table as well as UNCA and AP Tech, but not all of them share the same data systems. Woodfin does, shares the same system as APD and the Sheriff's Department. So that's, while many of the services are available, our ability to do the online tracking, not the electronic monitoring, but the tracking of who those high-risk offenders are is going to be limited to the database we have of this.
I understand, but we're on YouTube, and so I want to make sure in case somebody's looking at this from
But
some
if you
other-
saw the posters, you had the Black Mountain Police Chief, Woodfin's been at the table, UNCA Police Chief, I mean, they've all been at the table.
Bill, we've had a lot of work groups. They meet every Wednesday. The cohort work groups of folks who are going to be actively involved in this. And a lot of the challenges that we talk about are structural challenges and technology challenges for sharing information. And just to kind of bring a bigger focus on this, we're actually implementing 2 programs that have proven to be very successful in different locations. Nobody that I'm aware of is doing both but us, which means that we've got a lot of structure changes coming. It's been a tremendous amount of work, hasn't it? And it's going to be great in that everything that we do to bring this thing online is going to make us better with this particular problem in our community. But basically, you're starting with focused deterrence, which is the big end of the funnel. That's the first-time offenders. They get notified. They come under some scrutiny, and they receive some notification that this kind of thing isn't going to be tolerated. I think second-time arrest is where we're going. They get called in to one of these focused deterrence call-ins. And then you go all the way down to the small end of the funnel of that small percentage that actually kill their victim. And we're doing electronic monitoring for those folks. And we know by doing both these programs that we're going to catch a whole lot in the middle. And I think it's going to make us better overall in the criminal justice system, from law enforcement to the courts to pretrial release, and also with service delivery and how we really provide for these folks. And
I think another important thing to note for you all is the structure for how this will happen is already in place, because we've been doing it for 4 years with violent crime. So all the partners that we need to make a call-in happen, we already are meeting every month about violent offenders. And if we take our violent offenders, well, not if, we have taken our violent offenders and looked at them, 30% of people we have called in as violent criminals are also domestic violence offenders. So we will see a great deal of crossover. When Becky was saying, you know, you could be wearing an electronic monitor and an alcohol monitor, all I could think was, boy, that's a bad day when you're wearing monitors on all parts of your body because of your behavior. But that really is the people we're looking for, because what the focused deterrence model teaches us is that a very small percentage in any community is the ones that, okay, let me say this right, I'm getting tongue-tied. Perpetrate the most violence. 90% of the violence in a community is perpetrated by 5 to 10%.
3 to 5%.
He taught me all I know, 3 to 5%.
Yeah, and the sheriff was exactly right. It's a big funnel, because 3 to 5% of your folks in the community, in your criminal community, drive most of the violent crime. Now, with domestic violence, it's probably going to be 1 to 3% overall that commit an intimate partner homicide. So it's a smaller group at that end, at the small end of the funnel. The big end is going to be even bigger than it is for our violent crime focused deterrence, because for every person that we go to their house and answer a call for service where there's been a domestic violence incident, we want them at least to be notified the first time and have some kind of follow-up from our patrol folks that, you know, we're going to check back in with you, and we're going to make sure this doesn't continue to happen.
And to speak to what you're asking about municipalities, one thing about violent crime is when we were doing the gang model with the gangs, we saw that concentration of violence was in the city when we used the data. When we went to our violent offender model, we saw it reach all the way out into the county and into the other municipalities, because we have violent crime all over Buncombe County. So we've created a lot of relationships with the very agencies you
I
asked.
just wanted everybody to realize that we are talking about the entire county. A lot of
Absolutely.
times that gets lost. And I appreciate all the knots and everything that it is occurring throughout the whole county.
Well, and one thing that's important for you folks to know, the comment was made, glad to see the sheriff and the police sitting side by side. They've been in this very room, 18, 20 officers for the last 3 months, every Wednesday, working on a uniform protocol to respond to domestic violence. That's unheard of in our community. Probably unheard of in most communities, but that's how much they're collaborating. The last program we're looking at is actually the first program, the one that Holly Jones brought to us and said, look into this. The reason it's last and it's going to be implemented last, it's the only one that we didn't already have something similar in place for. It's completely new to our community. It is a multidisciplinary, high-risk domestic violence team that takes your highest lethality risk offenders and tracks them intensely with their services, with their employment, with their treatment, and also simultaneously works with the victim to provide that victim support. The general philosophy is the best way to keep the victim safe is to put the offender in jail. And that really is their focus for these very dangerous people. Again, that's disrupting the pattern. It started in Massachusetts. It's called the Massachusetts Model, a 6-year study from 2005 to 2011. They did 106 cases that were tracked by these high-risk teams. Some counties in Massachusetts have it and some don't. The data you're getting to see is pretty remarkable. In the counties that didn't have a high-risk team in Massachusetts over the 6-year period, they had 249 intimate partner domestic violence homicides. In counties with a high-risk team over the same period of time, they had none. I mean, if I were in Massachusetts, I would be moving to a county that had it. In Massachusetts, on average, 2010, 1 person died every 8 days from domestic violence, but none died in a county with a high-risk team. Their offender outcomes were remarkable. 59% were held in jail until trial. 71% at trial pled guilty. 62% got active prison time, and 20% that didn't go to prison had electronic monitoring. Their victim outcomes, 93% of their victims remained safe in the community and did not have to go into shelter. Their kids didn't have to move schools. They didn't have to lose their jobs. Only 8% reported a new act of domestic violence committed against them, and 90% of their victims engaged in services. Remarkable outcomes. Our plan in Buncombe County is to create that team. It would meet weekly. It would monitor these intense, high lethality risk cases with individualized case plans. Just as a general, just to wrap it up with some numbers, the leading cause of death in the United States for African American women aged 15 to 45 is being killed by an intimate partner. It's the 7th leading cause of death for women in our country, premature death. And over this period, 2004 to 2010, we had 75 homicides in Buncombe County. Approximately 2/3 were male and 1/3 were female. But look at the intimate partner relationship to that. Of those 2/3 male victims of homicide, only 4% were an intimate partner homicide. But for the women, 67% of those women who were murdered were intimate partner homicide. Huge difference. 50B complaints, there was reference to that earlier. That's a civil restraining order to when you allege domestic violence that the victim can file herself. In 1998, there were 992 for the whole year filed in Buncombe County. We've averaged, from 2010 to 2013, almost 1,360 filings per year. Helpmate Services, they do remarkable work in our community. They served 1,111 clients from July 2012 to June 30th, 2013. 85% of those were women, 15% were men. They made 386 referrals to Pisgah Legal Services, who provides free legal assistance for victims. They've made other service referrals. They've had civil and criminal court contacts. The 6 months from July 13th, 2013 through December of 2013, they served 668 clients. 87% were females, 13% were men. Again, making those referrals to fiscal legal, other service referrals, and then the civil and criminal court contacts. They're in the courthouse every day helping victims, whether they're a civil restraining order or a criminal case. They're there, they're helping them, they're support, they're amazing what they do. But as a judge, that's what I knew about HelpMate. I had no clue how much they do in the community outreach and their community counseling and their services that they provide. I've taken a tour of their shelter, it's phenomenal. Hopefully with this high-risk team, if our data's like Massachusetts, that shelter's gonna get emptier and emptier. And they look at me cross-eyed like, you really think that'll happen? But that's what the data says will happen. But it's amazing the work they do, and you walk in there and you see people trying to create a new life for themselves in a very small area, surrounded by a lot of people that all are very kind to them and loving to them. But if we can get them back in their communities and keep them safe, then we are serving them much better and raising children that will be healthier. These are the Buncombe County domestic violence homicides from 2008 to 2013. You can see the big one in 2013. The Attorney General's Office, you will hear reports in the news about domestic violence homicides. They do not capture intimate partner specific. They only talk about domestic violence. So when they give their numbers, it's a little bit of a distortion as to whether it was intimate partner or not. And that's where the sheriff has helped us to say that 5 of those 8 were intimate partner homicides. In this column, you'll see for each year the total number of domestic violence homicides in North Carolina. And you can see it's almost always around a little bit more than 100 per year. And Buncombe is, we had that horrible year last year, but 3, 3, 2, 5, 3, and then 8. So, and that's using the Attorney General's data. Last year, Guilford County had the highest. They had 11 domestic violence homicides. Buncombe and Wake tied for second with 8 each. Mecklenburg had 7. It's hard for me to imagine we have more murders around domestic violence than Mecklenburg. Durham, and then Harnett County. Our plan, the sheriff's mentioned it, Mandy's mentioned it, we have layered several programs together. No one in the country is doing this. This has been a huge undertaking. Just the commitment level from the county, the commitment from the sheriff, from the chief of police, from the district attorney, from everyone. So we've layered all these programs together. The cool thing about that is the research says when you layer programs together, you get better outcomes than if you just did that one program individually. So your community has really responded in an amazing way to look at this horrible problem to try to make it safer. And that is our plan, and we really appreciate your interest. Everything we've done is evidence-based. Part around the conversation that Mandy shares, and I don't know, you want to share that?
We're talking about the cross-system dialogue piece, and the sheriff and Commissioner Duncan and I had the opportunity to meet with a member of the bar about some of the questions, and at one point he said to me, "What do you mean evidence-based?" And I said, "Research-driven." His interpretation of evidence-based was that that was the point at which we were collecting evidence against his client. And it was, I mean, it's that learning each other's jargon and how something means something in my world totally different than it did. And that really was a turning point in the conversation where it's like, oh.
I have a question. And that person is an attorney?
No.
I can see his frame, evidence-based.
Well, I was sitting here thinking earlier that you didn't define domestic violence because I think you're talking about physical domestic violence, but domestic violence comes in verbal, emotional, sexual, and sometimes without any physical component.
Controlling the money.
It's a power relationship, and I think that as I was listening to you, I was trying to wonder, do we know how many are actually physical violence versus the other kinds? And that's...
Well, you raise a great point. Our county and our state has never tracked that kind of data. And so what we're going to do is go back from 2008 forward and try to get a picture of what was happening before these programs. And then there's been intensive work, and I don't know if you've met Dr. Creighton. Lee Creighton is now with the county and doing helping us create a data system so that we're tracking it correctly. Law enforcement's making a huge change. There's a call, go to this residence. It's a violent situation, they get there and they find out it's intimate partner violence, they're gonna go back and have that call changed to reflect intimate partner, so we can track this better. And we are gonna try to track the nature of the assault or the violence.
Could you speak just a minute about the communication plan for the community at large? I mean, I think this is such a wonderful example of the cross-agency collaboration and has such opportunity to impact. What are the plans around alerting the community in general to this work that's going on?
We saw the video.
Yes.
And that's being played now it's played on the county channel.
County channel.
A lot of us are out in the community on a regular basis, updating folks and making presentations. But I think that is clearly part of our plan, is to make sure that this message gets out. Now, not everybody's as polite as y'all and sit longer than you were asking for. And we appreciate these folks over here, man, they get awards because they've heard it like 7 times now. But that is the plan, is to really get this message out to the community.
I have a question. And are we allowed to, like, if I wanted to come and have a look at Helpmate, are we allowed to do that? How could I do that?
You can call me or email me.
I would like to come.
Yes. The short answer is yes. We wouldn't offer everybody that wanted to take a tour, but we will certainly. We will welcome anyone here
From the board perspective, I'd like to come. And as a person, I would like to come.
I'd love to show it to you. And now getting back to your question, if you look at the women in our shelter, on any given year, we'll house between 180 to 200 folks in our shelter, and they're there because they're in danger of being killed by their batterer, or they're homeless as a result of domestic violence. In shelter, almost across the board, they're going to report physical abuse, sexual abuse, mental abuse, economic abuse, he's controlling the money, etc. If you look at the women, the other 1,800 plus or minus women that we provide services to in any given year, they're not going to, they may or may not report all of those, but most everybody we talk to, I'd be willing to say, if we go back and look at every file, there's multiple types of abuse. But in shelter, I would say they're across the board, they're getting all of that.
And part of this plan also includes a relationship we've built with the FBI Victim Advocate, where we're going to be able to relocate people easier and maybe swap folks. Somebody needs to leave Minneapolis because they're about to get killed, and somebody here will go to Minneapolis to get away. And so we're working out strategies where we can communicate. They already, if they get a call and they're full, they call around to other shelters around the state to find places.
Where is the shelter?
We can't tell you.
It's an undisclosed location.
Well, but it's another question I had, because you all mentioned this, because there are more men that are impacted by this. There's not a male wing to your facility.
There is not. We provide all services to men and women except shelter. If a man needs shelter, and we have assisted many men over the years in getting shelter, we'll help them find another shelter. We'll help them get out of town. We have actually put folks up in the motel for 2 or 3 nights until we can help them get a place. But just logistically.
Yeah, I mean, knowing a little bit I do about shelter, it just gets too complicated.
And I'd just like to add also that Greyhound now we have a relationship with Greyhound, and folks that need to get out of town to be safe, Greyhound will give them a free ticket to relocate anywhere in the 48 states. Wow. So we will assist them in getting that. And we've had that relationship in place for about 6 months.
I think at the very beginning of your PowerPoint presentation, there was a poster up that says something like, Buncombe County does not tolerate domestic violence or intimate partner violence. I can't remember, but that was very impactful. You know what I would love? I would love to see that on billboards throughout.
Well, we actually have posters available if you want them in your workplaces, or.
Yeah, but I mean on as people are traveling through.
They're going to do building routes around
Buncombe
the
County
building.
does not tolerate this at all. I mean, that's a message. That's a very powerful message. And the other thing is, when we're looking at the decreased incidence of the perpetrators, with this crime, and there's a decrease in the second offense, so however you said, how do we know that those people are not moving out of the county, which means they will not have a repeat?
Well, what is
occurrence?
Really neat about this initiative, what Pitt and High Point have both taught us, is if they know that this family has moved, they call that jurisdiction and give them a heads up. So hopefully we will get more sophisticated in sharing that information with our surrounding counties. I mean, we have a lot of folks, who just jump over the county line, go to Madison or McDowell County to avoid CPS, or and it doesn't help, but they think it does. The Pitt County Detective John Gard was here, and he made a fabulous presentation. I think all of us could have listened to him for 2 days. But he said that they reported an inmate in the jail calling the victim, which happens to be against the law, and saying, of all places we had to move, why was it Pitt County? I would never have been locked up in any other county in North Carolina. And they have it on tape, and they love to use that as part of the presentation. But yeah, communicating around that. Any other questions? Or?
Thank you all so much. What a massive undertaking, and it's in good hands. And I mean, you all need to be very proud of what you're doing. You're helping the people within Buncombe County, and that's what this board is very interested in, finding out the various things that are going on. And what you're doing is just unbelievable. I look forward to the next report, all the percentages, as opposed to now versus a year from now. I hope I'm around to see it. But anyway, thank you so much for what you're doing. Thank you.
Bill, what I would add to that is, what I like is the cooperation, that no longer are you in your silos doing these same things individually, but seeing how all of these things work together. That's the thing that's impressive to me about lots of activity in Buncombe County. There's a lot, I think we're leading the state and perhaps even the nation in some of this type of collaboration, and I applaud that for all of you. And I've been a long-time supporter of HelpMate and will continue, because I think that's good. And I have just another little question. I know Pisgah Legal has a couple of attorneys at the hospital. What are you doing with the rest of the physicians and healthcare folks in the county to get them alert to this?
Well, a lot of them hopefully are coming to the training and signed up. They have a new forensic nurse, and her name is Susie Williams, and she might be knocking on your door someday because she wants to meet everybody in Buncombe County. She's here from Florida, and she's started a lot of forensic programs around sexual assault and domestic violence in Florida. And so she and I have been meeting, and we're not going to do the cross-system dialogue like we would at Pisgah, where we go over and actually talk to everyone who handles a domestic violence case, because they're so large. But they have massive protocols, and she and I are reviewing those protocols and making sure that everything is where it should be. And then they will participate in our community dialogue because they have so much information.
Thank you all so much.
If any member of the board wants to register and it's not registered for August 5th, and if there are any slots left, Krista can do that. It's a half day.
I'll make sure that there's slots somewhere.
I thought she might. And that partnership with Mayhead has been critical.
Thank you, Ms. Mayhead.
That's how we're going to train all the physicians going forward.
Good.
Again, thanks.
Oh, yeah.
I just can't quit thanking you all for what you're doing. And I'm going to make a chairman's decision. I'm going to decide that I'm going to make a motion that we adjourn. Do I have a second?
Second.
All those approve, say aye. Aye. You adjourn.
No, I actually don't
Right, which is a good. It was a good.